Welcome to the SNF Spotlight Series, brought to you by Renewal Rehab, a dynamic therapy company that provides full-service therapy for nursing homes. You'll be hearing from some of the leading nursing home professionals in the country, as well as many healthcare heroes that are sacrificing day in and day out to help your loved ones recover and come home to you.
Welcome back to the SNF Spotlight Series. We're proud to be launching our new website, so please do check us out at snfspotlight.com. This episode is sponsored by the incredible Renewal Rehab team, providing exceptional physical, occupational, and speech therapy to SNFs and assisted living communities nationwide. Today I'm privileged to be speaking with Joe Farkas, the CEO of Nova Senior Living. Joe, can you give us a little background about you and what made you go into assisted living?
Yeah, sure. Thanks for having me, first of all. It's a pleasure being here. So I started off in the SNF world. I did acquisitions for a pretty large privately held company. And from there, someone offered me the opportunity to come help them out with a assisted living that they were having some issues with. So I went there. I did a pretty phenomenal job there. They had a lot of problems with regulations. So that I handled that. They had the issue with census. We filled it up once we fixed the issues they had on the DLH end. And after that, there was many partners in that facility, so they asked me if I can help them out with other facilities that they had. So I had gotten a name of fixing up distressed facilities. And then from there, someone that I know bought a SNF and then attached to it was in a assisted living, or I would call in New York, an adult home. And he asked me if I'd come, operate it for him, which that was my, big break basically to start, operating my own. And from there, I went, I started operating that. And now we have many, many more facilities now under our belt.
So now you're currently, from what I understand, you have 4 homes in the New York area, another 2 homes in Florida, and expanding in that neck of the woods. How has the COVID situation affected? I understand like New York and Chicago and Florida has a different regulations. Can you give us a little background about what the difference may be?
So when it comes to, our company, what we did was we went above and beyond with regulations, as for us. We already, back in March already, before they said to lock the facility, we already, locked down our facilities. And that helped us tremendously. So, but, in New York and Florida, in the sense, they're not really much different of how, we have to take care of our residents and stuff like that. It's basically the same. And what I'm hearing from other operators, colleagues of mine that are in other states, technically, it's the same. They just care about the resident, making sure that everyone's safe and, taking care of our people.
So, would you say that it's been challenging? Like, has it been challenging? Like not being able to service them the same way, not being able to comfort them? Was there a lot of loneliness?
Yeah. So the whole thing with the assisted living model, again, I can't speak for everyone, but from most of the people I know in the assisted living space, the model there is to be a family. So being a family is eating dinner together in a nice lunch, dining area, breakfast together, playing different activities together. So that togetherness is not there anymore. Now we have to start serving them in their rooms. And certain facilities, we can have them in the dining room area, but it has to be 6 feet apart. So you don't have that family life anymore. Which I'm fortunate that we don't have that. So yeah, that's been the biggest challenge of, especially without that, they do get a little more depressed. Besides not, being together with the residents themselves, who they consider family, their own family, they don't have either.
So I was under the impression that assisted living, each person has like separate apartments and they each have their own sort of kitchen and own dining room. Am I totally wrong on that?
That's more of independent living. Independent living would have their own thing. No, but here we do serve them, and we can't administer their medications but we have to make sure that they do take it. We give it to them, but we can't administer it. That's the only difference between SNF and the medication part. But yeah, no, the only ones that have their own kitchen and own area is independent living.
So when would you say a patient should go to a nursing home or a SNF or assisted living? Like, when would the difference be? Who would be the ones to decide that?
So of course that would be, the doctors and nurses, and those are some regulations of what, we can do to assist. Assisted living is really, you're on your own. Again, we do help with the medications, and there's different levels, in New York at least, there's different levels of assisted living. One of them is an ALP, assisted living program, which there we can do some nursing services, but not as much as a SNF. Once they have a certain ADLs that are too much for us to handle, then we have to get them evaluated, and if they don't qualify for AL, then we send it to a SNF. But in general, any other AL, a regular, or in New York as it's called, adult home, that doesn't have that AL program, there's not much that we can do to assist. I mean, we could help them, go into the shower. We could help them. We can't, if they need a lift assist, for example, that's really not a qualification for an adult home.
So would you say that there have been, census in general has been down, would you say that a lot of people who have their loved one that could technically, they have a pretty high ADL, but enough to go to an assisted living community, would a lot of them may have not sent them there now during the time because of COVID? They wouldn't be able to come visit and things like that?
Of course, 1,000%. And we see that all the time. We have family members that, they sign up, they say, we're ready for it, but not now. Once the COVID situation gets better, and I understand them, they basically put their loved one in a facility and they won't see them, and they're not allowed to come see them, through window visits or Zoom. Is not the same as, face-to-face interaction. It's something which I understand completely. It's, anybody would feel the same way, that if they're putting their loved one into a facility and then that's it. There's no, basically, goodbye, I can't see you. So we do have that all the time. We have people calling us, like, listen, my father, my mother, my grandmother, they're ready for the facility, but we're just letting hold the bed. We're not holding beds if we don't have to, but we're ready for it. But once the COVID situation gets better, or as now we're rolling out the vaccine, so hopefully after that it'll get a little better.
So with regards to the vaccine, they started rolling it out a couple of weeks ago. Do assisted livings have the same rights as nursing homes, or is that different?
What do you mean by rights?
Meaning, are they have the same priority? Do they get it?
Unfortunately not. Which, again, I don't know other states, but in New York for sure not. I actually have a colleague of mine that has a facility in New Jersey, also at the same situation. The SNFs got it already, they already have it rolled out by them. We are scheduled hopefully for the end of the month.
So Joe, dealing with Nova Senior Living, where do you plan on taking this? Like, you're a young operator currently, you've grown it. What's the goal? What's the 5-10 year plan?
Well, if you would have asked me a couple of years ago, I would have said I want to own 150 facilities. Now, I'll tell you a couple more. I just want to, what I have right now, I want to make sure it's perfect. I don't want to go out and buy, a next package of 100 facilities. Not saying that I won't, but definitely would take a lot of consideration and consider it and make sure I have the right team to do it. But it's definitely something that I would, love to grow slowly but surely. Make sure what I have doesn't get, lost. Because I did work very hard on those others. So not me myself, but with my team, we've worked very hard to have a name of who we are, that we do care about our residents, we care for our staff, and we do a really good job of that. And I'm proud to say it. So I don't want to lose that. So again, 5-10 years could be another 5 facilities, or it could be another 20 or another 100. It doesn't. It's not a goal that I'm. And there's no number that I put to it.
So being an operator for a while, what would you say Nova Senior Living, what's their sweet spot? What do you guys provide that others may not?
So really our specialty, what we've become to known and what people in the industry know us as, that we take facilities that underperforming facilities, not always, but most of the time we take underperforming facilities and we turn them around. That's our, basically. So when somebody's in a facility that's not the greatest resident, then we come in there, they think we're doing it. So that's basically our sweet spot. We come, we help, and we're also on the ground. I myself am at the facilities all the time. It's not like I do have regional, somebody that goes around, but I myself come to the facility, either myself or someone that's high up on my team, that we're always there, and we are available to speak with family. It's not like that if a family member needs, I'll pick up the phone and I'll speak with them.
You're really taking care of those patients, being like a fatherly figure. So what would you say if, let's say there's someone who has a home, an assisted living, maybe watching this, how would they approach you with an offer of like, hey, I have this home, what would they do?
I'm a very approachable person. They can just call me. People who know me, I'll speak with anyone. Listen, I started off from the bottom, really. So I that's one thing I never forget, where I came from. So I'm definitely very, very approachable, and anybody, and I'll tell you straight up if the deal's for me or not. And if someone asks me for help, if they want to get into business, it'll be my pleasure to help someone start off as an operator. So if you want, you can give them my number, my email, and I'll definitely gladly speak with them.
You heard it from his mouth. Contact me if you want to speak to Joe Farkas. Thank you so much, Joe, for spending the time with us, and thank you all for watching. Please check out our website at snfspotlight.com. Thank you.
Thank you for having me.
Thank you for listening to the SNF Spotlight series. Please subscribe to our channel, as there will be many new and exciting episodes from our healthcare heroes.